Hi. So many times people ask, what's the training of a chiropractor? A patient might want to know, like, how do you become a chiropractor? Is it equivalent to a real doctor, a medical doctor, an osteopath, or is it appropriate that chiropractors are considered primary care physicians? Let me go over a little bit about the training and then you can decide for yourself. So the first thing here, this shows the total number of hours of training chiropractor versus a medical doctor, and you can see at the bottom the total hours are pretty close and similar. And how do they differ and why do they differ? So this next slide here shows that chiropractors tend to have a significantly more in-depth study of orthopedics, X-ray, and neurology compared to the typical medical student. And the medical student has a higher level of class hours in gynecology, obstetrics, chemistry, and pathology. So the study of disease and obstetrics and gynecology, which doesn't really pertain much to chiropractic. But then beyond that, what medical doctors do is they do a 2-year residency rotation. This adds to their schooling. So the first 2 years are the academics, similar to chiropractic, but then the next 2 years, they're rotating through a hospital and they're seeing neurology and they're seeing orthopedics and dermatology and different rotations. Chiropractors don't do that. They go right into the equivalent of the residency program, the same way that dentistry does. So in dentist school, you do the same type of medical education, but then you go right into dentistry. You don't go through a whole bunch of rotation. Same thing with chiropractic. And I don't know what it's like so much now, but when I was in chiropractic school, we did 2 years of on-site at the school internship residency program. And then in Florida, I completed another year. So a total of 3 years of clinical hands-on work before I was licensed. And that's similar to many of the degrees you'll see in medicine. A lot of times a 3-year residency program in medicine is internal medicine, preventative medicine, pediatrics, family medicine. So the type of education is very similar. The real main difference is that physicians who have practiced medicine, who work in a hospital, did 2 years of rotation through gynecology, dermatology, all sorts of other ologies that, to be honest with you, I don't really care much about because I don't use them in my practice. I'm doing hands-on work every day, and if you speak to most medical doctors who are out in practice for 20 years, they don't remember much of what they did during that 2-year rotation as well. Good experience. I'm not saying that you shouldn't. It's just the same. So overall, practical knowledge is relatively similar, but you can decide on your own.